Today, we're going under. We're exploring the absolutely fascinating medical story of anesthesia. It's something millions of us go through for everything from routine procedures to major surgeries, but let's be honest, very few of us really understand what's happening to our bodies.
I mean, have you ever really stopped to think about it? It feels so simple, right? You fall asleep, and what feels like seconds later, you wake up. But the reality? Oh, it is so much more complex. So today, we are going to pull back the curtain on this whole process, from that very first moment you drift off to the second you wake up.
All right, let's dive right in by starting with the absolute basics. What exactly is anesthesia, and how in the world does it pull off what seems like, well, magic?
Well, at its heart, anesthesia all comes down to these incredibly powerful drugs called anesthetics. What they do is they interrupt the nerve signals that are constantly zipping from your body up to your brain. Think of them like signal jammers for your nervous system. But, and this is important, they don't all work the same way or on the same scale.
Generally, you've got two main paths here. On one hand, you have general anesthesia. That's the one that puts you completely to sleep, a total loss of consciousness, sensation, the whole shebang. Then you have local anesthesia, which just numbs a tiny little area. You know, like when you get a filling at the dentist, you're wide awake for that. For our deep dive today, we're going to follow the journey of general anesthesia.
Now here's what's really fascinating. Going under isn't like flipping a light switch from on to off. No way. It's actually a super carefully controlled descent through 4 distinct stages. And anesthesiologists, they're the expert pilots guiding you through each and every phase. So the journey starts with stage 1, analgesia, where you start to lose that sensation of pain. Then you hit stage 2, which is this brief, kind of weird excitement phase. That happens because the drugs actually knock out your brain's impulse control first. Stage 3, though, that's the goal. That's the sweet spot, surgical anesthesia, where everything is calm and stable. But there is a 4th stage, medullary paralysis, and that is the danger zone that these doctors are expertly trained to steer clear of.
Now look, for the vast majority of people, this process is incredibly safe. But in some really rare cases, a patient's own genetics can turn this controlled flight into a life-threatening emergency. A sudden, violent storm inside the body.
This incredibly dangerous reaction has a name, malignant hyperthermia, or MH for short. And for people who have a specific genetic mutation, certain anesthetic gases can basically light a fuse inside them, triggering a massive crisis.
It's what's known as a hypermetabolic crisis. That means the body's metabolism just spins completely out of control. See, the anesthetic triggers a genetic defect that floods the muscle cells with calcium, and that sets off this runaway chain reaction of intense, full-body muscle contractions.
And the stakes? They could not be higher. Before we had a treatment for this, an MH crisis had a mortality rate of 70%. This isn't just a little complication, it's a full-blown internal meltdown. The body's metabolism goes into total overdrive, generating incredible heat and flooding the system with acid.
So, the surgical team is trained to be on high alert for the telltale signs. They're watching the monitors for tachycardia, that's a sudden spike in heart rate, and hypercapnia, a sharp rise in the CO2 you exhale. They're also physically watching for severe muscle rigidity, especially in the jaw, and a body temperature that starts climbing way too fast. Even the patient's urine turning a dark tea-like color is a huge red flag.
So how do you stop this runaway train? The second MH is even suspected, an emergency protocol kicks into gear. The response has to be immediate, it has to be coordinated, and it has to be precise. There's no time to waste.
And the hero of this story is a drug called dantrolene. It is the one and only specific antidote for malignant hyperthermia. It works by going right to the source of the problem. It blocks those receptors in the muscle cells and stops that uncontrolled release of calcium, bringing that whole devastating chain reaction to a screeching halt.
And the protocol they follow is just a masterclass in emergency response. Step 1, stop the trigger. Cut off the anesthetic. Step 2, get that IV dantrolene in right away. Step 3, push 100% oxygen. Step 4, start actively cooling the body down with ice packs and cold fluids. And finally, step 5 is to manage all the secondary problems. Every hospital has a dedicated MH cart ready to go with everything they need to turn that chaos into a structured, rapid, life-saving response.
So after the surgery's done, whether it went perfectly smoothly or involved a crisis like MH, the final chapter of the anesthesia journey begins. This is the gentle return trip to consciousness. and it happens in a special place called the Post-Anesthesia Care Unit, or the PACU.
As those anesthetic drugs start to wear off, your body has to take back the controls. And the PACU nurse's first, most critical job is to check your ABCs: airway, breathing, and circulation. They're making sure your airway is open, that you're breathing on your own, and that your heart and blood pressure is stable.
Okay, once the ABCs are all good, the focus of their care starts to shift. In those first 24 hours, the main worry is bleeding from the incision. They're watching that, dressing like a hawk for any signs of trouble. But after that first day, the risk of bleeding drops, and a new concern pops up on the radar: infection. Now they're looking for things like warmth, redness, or a fever.
You know, when you really think about it, from that controlled descent into unconsciousness to the rare but violent crisis when the body fights back, the story of anesthesia is just remarkable. It really highlights this delicate, powerful balance between modern medicine and the profound mysteries that are still hidden deep inside our own biology.